Before we had Zimmer, we had Interlace. We started with that in about 2002, 2003. We did about 15,000 cases with Interlace and with all their upgraded iterations. We came to a point where we were going to have to either upgrade with Interlace or get another laser. We started looking around, started asking 2 or 3 other surgeons who had had Zimmer for 2 or 3 months, and they were so excited about their results that it was just infectious. So based on their reports of how happy they were, how happy their patients were, we decided to go with Zimmer, and we've been happy ever since. When it comes to new technology, I'm always a skeptic. I don't want to be talked into something that's not really there. So even though we purchased a Zimmer, we didn't know what we were going to get, and we expected nothing. But the amazing thing about it, on the first day that we did Zimmer, I did about 15 or 20 eyes. The next day when I came in, I could tell by looking at the patients' faces that things were better and things were different. You could see their smile clear across the room that we weren't used to. Their eyes were white and quiet. They had no discomfort. They had better vision than we expected from the past technology. And the amazing thing about it, they had no DLK. We were not used to that because with the other technology, we almost always had peripheral DLK. And we didn't have that with the Zimmer at all. So DLK has become quite rare in our practice now that we have Zimmer. The healing time improved immediately. These patients were asking to be discharged at 1 month because their eyes were comfortable, their vision was great, and they couldn't even remember that they'd had eye surgery. It just made us feel really good that we had picked the Zimmer technology. The Zimmer team is really customer friendly. They bend over backwards to make sure that our laser is always ready to go. We just had a great experience through about 17,000 cases now that the Zimmer team takes great care of us. I like the beautiful flaps that it makes. I like the fact of low energy, which apparently has just almost completely done away with DLK and patient discomfort. You know, most of our patients would not have to take any steroids after the first post-op day. And if we never saw them again, they would do fine. It's affected the economics significantly because, first of all, these patients are so happy. So they go out and tell their friends, and we have a significantly increased word of mouth because of Zimmer compared to Interlace. And then these patients are so easy to take care of. 98% of them we could see only on the first post-operative day, tell them never to come back, and they would be super fine. This sort of thing increases our word of mouth, increases patient satisfaction, increases visual results, and it also makes our doctors who work in the clinic happy because they're not there having to explain this problem or that problem. They're not there having to say, well, we're going to have to see you for the 7th time in 2 weeks. It is so easy for them to take care of these post-op patients. I would say to carefully look at Zimmer, because if you don't, you are probably omitting the best possible technology for your patients.